Welcome to Elevate Care. I'm your host, Steven Endsley. Today, we're joined by Alan Vierling, Chief Nurse Executive at San Juan Regional Medical Center, for a conversation about why developing nursing leaders has become a strategic imperative for healthcare organizations. As health systems navigate workforce transitions, growing operational complexity, evolving technologies, and increasing demands for quality and financial performance, the role of nursing leadership continues to expand. Yet many organizations are facing leadership pipeline challenges, succession concerns, and increasing pressure on frontline leaders. In this episode, we'll explore how healthcare organizations can build leadership depth, strengthen readiness at every level, and develop future nurse leaders and create the conditions for long-term organizational resilience. We'll also discuss the growing importance of data fluency, leadership agility, and how CNOs can position leadership development as a key driver of workforce stability and patient outcomes. Alan, thanks for joining us here today.
Thank you, sir. Appreciate it.
Yeah, you came from the sunny state of New Mexico, correct?
I did.
Yeah.
300 days of blue sky.
Oh, and I got a chance to view the facility there that you have. Wanted to see if you might be able to talk a little bit more about the facility that you work at,
Yep.
and also a little bit about your role there.
San Juan Regional Medical Center is over 100 years old, founded by the community. It is a roughly 200-bed facility, level 3 trauma, serving the Four Corners region. So while the city of Farmington, where it's located, is relatively small, it's got about a 500,000 person service area that extends over several thousand miles. We serve a lot of the Navajo reservation, the Utes, a lot of rural Four Corners region.
Mhm.
So, but we provide, neurosurgery, and we provide interventional cardiology and a great trauma program and a number of other things really focused on pediatrics. So it's the referral center, for the location. And we have probably one of the more robust aeromedical services with two
That's right.
fixed wing aircraft and a rotor. And these guys can be, anywhere from 5 to 12 flights a day.
Yeah,
They are really busy. Yeah.
I know you shared that with us when we were there. That was really interesting. You actually even have a business, I think, in that, correct? Where you actually help support other health systems with that
We
aeromedical
do.
team?
That's right. We support a lot of the hospitals throughout the region
Mhm.
with, flights into us for some, but also from other hospitals to Albuquerque, Santa Fe, Phoenix, Denver. We fly all over the Southwest, and it's a robust business. It's a robust industry, but the nature of it is so rural that fixed wing aircraft is really important. And of course, with 300 days of blue skies a year, you get a lot of opportunity to fly.
Yeah. Well, not only just to serve your community and those around you, but also just an opportunity as a rural health system looking for that revenue to try to generate. As you talk about the complexities, that's a big thing.
Well, rural health is struggling across the country. So
Yeah.
any opportunity we have to run a revenue generating business on with a positive margin, we need to take that opportunity because that money always translates back into care.
Yep.
And so it's important for us to optimize as much as we can.
Yeah. Well, and that's the big thing is people, again, when you think about what we do, we're in the business of healthcare, which is the business of caring for people. It's not necessarily a business like every other business. So there's a lot of unique nuances we have to work through to make sure that we're balancing the business and that care model. So yeah.
Yeah, it's absolutely an imperative. And it's one of the things that we have to talk a lot about nurse leaders with. We have to make sure they understand this is a business.
Yeah.
And, we're in a high tech, but high touch, but it's a business at the end of the day. And you have to be able to, turn enough of a margin so that you can continue to invest in the community and invest in the things that you need, to move forward with in a positive way.
Yeah. Well, I urge anyone to go to Farmington, New Mexico. It's a wonderful city. I had a great chance to see it and join you all there. Let's talk a little bit about your role at San Juan. So you're the chief nurse executive. So we talk about the business of caring.
Right.
Your job is to manage the business of caring. Talk to me more about what you do there.
So the chief nurse executive probably is one of the most fun jobs I think anybody could ever have. I really, I love nursing. It's the second best job, second best thing I've ever done in my life. Besides being a dad and a husband, nursing's extraordinary. So it's the CNE's role at San Juan Regional is really about safety and quality and care delivery and creating the strategic plan and the care paradigm and what are we going to do to really enhance nursing and lead nursing in a different way. And in fact, what we're at now, our strategic vision is to lead New Mexico as the preeminent nursing organization in the state. And we are on track to do that. We feel very positive about the path we're taking, but the CNE's role, it really is to set that vision and then help develop and create great leadership pathways that allow us to make that vision become reality, because it's always a vision until you do the work.
Yeah.
right?
Yeah.
And so we want to do the work and make it a reality. We want
Yeah.
to go from vision to reality. So that's the chief nurse's job. And I'm very fortunate to be there and work in a dynamic environment that has lots of opportunity for success.
Yeah. And I've gotten a chance to know you for some time now, and you have a very unique journey. Your journey has been incredible to see you get to where you're at today. And I think that's a big passion. You're a natural leader. You can sense it and feel it when you're in your presence, and your willingness and wantingness to help support the future. Talk about your journey. How did you get to where you're at today, and some of the things you've accomplished and been able to kind of work through?
Yeah, so it has been a journey for sure. So I started off as an operating room technician, trained on the job right out of high school. My first summer out of high school, I was actually planting azaleas for a surgeon, and he asked me if I'd ever been to a doctor's office,
Mm-hmm.
and I said no. you know, and so that's how it started. And then ultimately, I went back to nursing school, and from there, it's just been a progression of taking on opportunities.
Yeah.
People would say, "Hey, do you want to do this? Or do you want to run that? Do you want to be the manager? Do you want to be the director?" And I kept saying yes. And so I was a emergency room manager and an OR manager and OR director in pediatrics and psych inpatient and out. And eventually I landed about 11 years after I graduated from school. I landed as a vice president of surgical services at Carilion, and had really some great mentors there that to this day are still important in my life. And then from there, I became a manager of 40 rehab facilities,
Okay.
which was different because
Yeah.
it took me to spread me across a couple of states and
Yep.
multiple sites. And then I became a chief operating officer of a healthcare system in Ohio. And I went from there, decided I wanted to get a doctorate degree and really focus on some personal development. So I went and became a consultant and did IT work for 3 years. And then I ended up back at a hospital in Houston, Texas as a consultant. And they hired me to be the senior vice president of operational transformation,
Yeah.
which gave me an opportunity to really look at a system-wide approach to making things different and then doing some things. And we had great success there with some really novel things that changed culture and changed the dynamic of the hospital and turned it around and went from being, a single digit patient satisfaction place to a place that was over 90 percentile patient satisfaction
It's excellent
routinely, and
work.
a magnet facility and whatnot. Then from there got recruited to be a president. And so I was a president ultimately in Texas, and then became a president of a hospital in a 700 bed level 1 trauma center in Michigan,
Mm-hmm.
and went through COVID and went through a very, very difficult Joint Commission survey, 10 immediate threats to life, 250 citations, about 6 weeks after I arrived. And so we had to kind of come out of that, not only operational struggle, but that reputational
Yeah.
challenge that created. And then I got my opportunity, of course, to work with unions for the first time, which was really a great learning experience for me, and worked with some great people. And then went from there to the Alaska Native Health Consortium, and I ran the Level 2 Trauma Center for the Alaska Native
Mm-hmm.
Medical Center, the 400 Physicians Clinic, the travel office. When you say we ran a travel office for a hospital, what was that like? Well, we did 46,000 flights a year.
Jeez.
And so half of your patients come in from the rest of Alaska.
Yeah.
And I ran 5 hotels, which was new because when people come in from the bush, they come in from the rural areas, you got to put them up in a hotel.
Yeah.
So it was my first time to have hotel experience.
Interesting. So you got some hospitality.
Yeah, I really did. I mean, it was a very different thing to all of a sudden go from hospitals to hotels. It's like, oh my God, what do you do there? Well, checking in's a big deal,
Yeah.
right? So you fix those kind of things. And then we did the insurance product in 700 plus field clinics, which took me all over the state of Alaska, from, Dead Horse all the way up on the Arctic Ocean, all the way out to the Aleutian Islands, to Akutan and Adak, and then all the places in between. So I spent a lot of time in small planes, landing in little clinics on gravel runways,
Yep.
and then taking a snow machine to get to the clinic, or taking a 4-wheeler to get to the clinic to see the 5 people that worked that day. And then, quite honestly, I was at home. I'd finished. My wife had only worked 3 years in Alaska, right? Too far away, 3,000 miles from home. So I was sitting at home on a tractor, and a good friend of mine, who's the human resource officer at San Juan, called me and said, "Hey, we've got this issue about nursing, and nursing needs transformation.
Yeah.
And I don't know anybody else that would take this on. Would you do it?" And so got off my tractor and went and talked to my wife and said, "Neil called," and we had a talk about it. And
Yeah.
so that's where I am.
Yeah. No, that's great. I mean, I think what I'm hearing is it's not a straight line.
Oh, my
It is.
goodness.
Nothing is a straight line when it comes to leadership.
No, and it never will be. And that's one of the things that you have to really get the young leaders to figure out.
Yeah.
There's not this sequence of events that's going to occur on your time frame.
Yeah.
It's very much like raising a child.
Yeah.
Your growth as a leader is really, it's really going to be different. There's going to be some moments of exceptional performance and exceptional outcomes that humble you and make you really proud to be standing amongst this crowd of
Yeah.
people. And then there's going to be some moments where you're scratching your head thinking, what did I do?
Yeah.
And it's not always a straight line.
Well, and relating to from the parent mentality, no one gives you a book. You never know. You're
Right.
just figuring it out, and everything's a little bit different. So you have to figure out same concept, and that's the big thing about leadership. I think, as you alluded to, is being relatable, making sure that you have that ability to get to someone into their everyday life and finding a way to connect there. Um, go elaborating a little bit more on the not a straight line. What's your or one of the things I know you're passionate about is setting young leaders up for success. And how do you see that happening today? And, how are you working with your young leaders to help support them into understanding that journey that they're going to be going on?
Yeah. As I've gotten older, I've understood more about the things I maybe should have done, could have done, wish had happened with me.
Yeah.
And so try not to make those mistakes again.
Yep.
So one of the things that I really am passionate about with young leaders in particular is their growth and development, both in a structured and in a not structured way. So let me give you a tactic that we use about three different tactics that are really important to us. One, we do a group book club. And the expectation is we all read the books. They're usually small, short, get them done in a month.
Yeah.
But we meet together in a very protected space where we get to have an open ranging conversation about the key concepts, whether it's about hospitality or crucial conversations, or it's about leadership characteristics, those kind of things. And so the book clubs give us a sort of guided path. And then on the not so guided path, we do skip meetings.
Yep.
So a skip meeting is where the executive drops below their level of report. So I go past the vice president and I meet one-on-one or in a group setting with all of the directors of nursing. And then I skip further and I do a meeting with all of the managers or the managers one-on-one.
Yeah.
And I try and do this monthly so that they get lots of access to somebody who's probably made every mistake that you can imagine.
Yeah.
And every mistake we try and fail forward.
Yeah.
We don't want to do the same thing again. So we do those sorts of things more and more today than we did. It was almost unheard of when I was growing up. I never saw the chief nurse. I didn't know who I knew who it was, but
Right.
I didn't have a dialogue, and I always called her Mrs.
Yeah.
And we didn't really have a relationship. And I think because of the generations that we're with today, it's a much more collegial, much more authentic
Mhm.
relationship where I am invested in their growth and development today in a way that just didn't happen until I became a vice president. And then I sort of, all of a sudden I got access to all this great learning and I got access to the coaches. And so one of the things we're changing relative to that is we're saying to people, what if I got you a coach now?
Right. Early on.
What if I got you a coach early on? That's right. So I get to optimize this experience. And so your impact is broadened earlier in your career.
Yep.
Waiting until the very end when you're having fewer direct conversations. Now you're talking to frontline staff, right? So how do we help you create that emotional intelligence? And how do we help you work through the crucial conversations in a way that everybody feels respected and valued so that
Mhm.
it's feedback that's honest? And how do we help coach you through those moments? Because that's really where it's scary in the beginning,
Right.
or is doing those hard things. And so we've changed how we look at coaching. We've changed how we look at one-on-one skip meetings. We've changed how we look at, learning and development and growth and putting people in real-time experiences. And then we also look differently today at how do we figure out who the young leaders are that might be coming up,
Yeah.
and how do we tap them?
I don't think there's a secret sauce, but how do you think is the right way to figure something like that out when you find those people? Like, how do you know if someone has it?
That is the way I figure we sort of look at leadership and say, who's got the potential to lead
Yeah.
is first up, I'm gonna be honest with you, it's desire. If somebody tells me I never want to do this, then I'm not going to waste my time because they've got something in their mind that
Yeah.
says can't do it. But if somebody says, I'm curious, I want to be a unit champion, I want to be a preceptor, I want to be a charge nurse, I want to be an XYZ.
Yeah.
That's the first step. The second step is, how calm are you?
Yeah.
Are you that person that has a sense of, I'm just not going to let this get out of control, right? We talk a lot about people diving off the deep end. Well, sometimes you dive off the deep end, but the pool has to have water in it,
Yeah.
right?
Yeah. You got to be able to swim in something.
Yeah, you got to be
Yeah.
able to swim in it. And so we're looking for that person who's not diving off the deep end into an empty pool.
Yeah.
They're really raising the right questions. They're really asking the right sort of things. And we're really looking for the beginnings of high emotional intelligence.
Yep.
One of my former mentors told me frequently, IQ gets you hired and EQ gets you fired.
Yeah.
And so we're looking for people who have that sort of innate ability to be respectful and kind and give feedback and in a constructive way that's helpful, right? And so we see that amongst our preceptors, we see that amongst our unit managers, we see that amongst people, and we say, really, we need to invest in them and
Yeah.
help them grow. So it's sort of there's not a checkbox like you said. There's certainly not one, but we do look for the desire to do it and B, the willingness to learn. Really humble, hungry, and smart, right?
Yeah.
I want you to be hungry enough to want to do the job. I want you to be humble enough that you realize could be better. And I want you to be smart enough to understand how to make a difference.
Yeah. And I would, you've touched on it a couple times, when I would double down that emotional intelligence. I think that's one of the things that it's hard to tell, especially nowadays if you have young leaders, because there's a lot of technology that allows people to communicate in a very different way. I'm curious, if you look at the generations of you've worked through many generations of
Yeah.
leadership.
Yeah.
What do you see as the unique things in the upcoming generation of leadership, and some of the things that other healthcare leaders like yourself need to think about when they're trying to create those pipelines of the young leaders coming up?
The nursing staff, which is where we draw all of our leaders from, are trained on simulation. They are trained with their technology and their devices, and they've grown up in a world where face-to-face contact, making eye contact,
Yeah.
is not always comfortable.
Yeah.
And they're trained in a way, and they've grown up in a world where they can send a text message and walk away.
Right.
They don't have to sit and have that hard conversation.
Power behind the keyboard.
Right,
Yeah.
right. Keyboard warriors.
Yeah.
Right. And that's who they are. And that's how they've been trained. So we have to think now about how do you put that away and teach them the softer skills
Yeah.
and get them to grow in that fashion. So one of the things we do a lot, especially early on now, is we do simulations. I have this conversation really frequently to say, okay, we have to have a hard conversation with the employee. Why don't you come to my office and let's practice?
Yeah.
I'll be the employee and you do it, and then we'll talk about it. Or you go and you practice with the vice president or the director, whoever, and I'm going to watch, or one of our HR coaches is going to watch,
Yeah.
and we'll give you feedback on how to do this differently. Because being able to make eye contact, keep your voice in a nice level, connect and be authentic, and that connection's where we miss a bunch.
Yeah.
It also impacts patient care and patient satisfaction if we don't connect with our patients. So you got to be real. And so we're working on that because that doesn't involve technology. But yet at the same time, we have to use technology as a way to teach, because that's how this current generation's grown up. And one thing I would note is that the baby boomers and the millennials, and they've all adapted to technology.
Yeah.
It's not like we're not capable.
Right.
It's that I think there's a balance later on in your career of understanding, okay, I'm going to use the technology for its benefits, but that's not as good as having a face-to-face conversation.
Right.
And we also, by the way, put some pretty strict rules around when are you going to text, when are you going to email, and when are you going to call. And for instance, if you're doing your third email, we stop.
Yeah.
I make you pick up a phone. I won't answer it. We're going to have a dialogue.
Yeah.
Right. First email, I answered back. Now you answer again. No. It's time for us just to talk. It'll be faster. In the same way, we have expectations around texting. If I want you to respond immediately, I'm going to call you on the phone. If I want you to respond eventually, then I'm going to text you. If I don't care when you respond, then it's an email.
Yep.
But we actually write that down, set it as a parameter, and give that to all of our leaders and say, we're going to live by this.
Yeah.
That way we're all clear about the importance of the phone call, and we're clear about the importance of the text, and we're clear about the importance of the email. So there's no miscommunication about expectations. And so that's another way we've kind of have tried to get technology to our benefit, but yet set standards and expectations for everybody.
Yeah. Well, one of the things I think I heard in there too, when you just talk about that future leader or just leaders in general, is you got to be uncomfortable. You're going to get put in a lot of uncomfortable positions when you're a leader. And if you don't go into that level of discomfort and actually take it head on and just think you can avoid it with a text or something, it's going to definitely stunt your growth as a leader.
You have to sit down and have to have a conversation.
Yeah.
And there's a point in time in every relationship, doesn't matter if it's at home or at work, when you have to have a hard dialogue.
Yeah.
And it's a lot easier to do that when it's based off of trust.
Yeah.
But I'm never going to trust you until you and I sit and have a lot of conversations face to face.
Yeah.
I don't trust anybody on the other end of the line, because on the other end of the text message, because I haven't met them yet.
Right.
Right. And so that's a large part of what we do. And it's one of our leadership tenets is we're going to be trustworthy, and we're going to be trustworthy all the time. But that requires we invest in the relationship. And that's a dialogue face to face.
Yeah. Well, when we look at, so we've talked a little bit about setting our future leaders up for success. What are the barriers you see right now? What are the things that are holding us, and not just necessarily in your organization, but in healthcare in whole? What are the barriers you see right now that hold us, that kind of hold it back? And what recommendations do you think we can make to be better to help enable them as well?
If I was going to look at nursing leadership in particular, a couple of barriers immediately pop to mind. Their span of control is extraordinary. They
Yeah.
are 24 hours a day.
Yeah.
They are 7 days a week. They are oftentimes over 60, 90, 100 people. And so that span is incredible.
Yeah.
And then if you get past the number of people they're taking care of, look at what they're responsible for: safety, quality, engagement, finance, physician satisfaction, recruiting, marketing in some cases, clinical excellence. They have to be on the edge for evidence-based practice. We give them such a large job that it's almost overwhelming.
Yeah.
And so and it's daunting. And then when you look at their pay comparatively, this is one of the most important issues for us in healthcare as leaders. We have to figure out, I can make more money staying at the bedside today and working a shift of overtime and still work fewer hours
Right.
than a nurse manager,
Less
than a
stress
nurse.
too.
Right. And by the way, that's predictable.
Yeah.
I know where I'm going to be for this next 40 hours or 48 hours. But that nurse manager, they may have already worked 50 or 60, and they get 2 call-offs on a shift on a Saturday, and now they have to figure out how to solve it.
Yeah.
So there's no break. And then if you look at our age group of people that are trying to be in the middle of this mix, what are they doing? They're starting families,
Yeah.
and they're experiencing life. And so at the very time when we want them to be the busiest, they have all these other obligations. So one of the barriers for us right now is to figure out how to really bring that into a reasonable lifestyle, because that's a difference between a boomer born in 1960 versus somebody born in 2001.
Yeah.
It's a big difference, right?
Yeah.
I grew up in this environment where, we wanted to live to work. I'm happy working 50 hours. It means I'm a good guy,
Yeah.
right? Versus I'm going to work to live.
Yeah.
And it's a big shift.
It
So
is.
we as leaders have to figure out, how do you do that? So how do you give them time? How do you give them balance? How do you allow them time off from work in these 24-hour day jobs? How do you give them the opportunity to get mentored at a high level with well-experienced individuals? Because that's very valuable to them.
Yeah.
And then how do you reward them in a fashion that's not just necessarily pay, but how do you reward them in a fashion that really shows them they're important?
Yeah.
Because, this is a whole population that really grew up with a lot of pats on the back and a lot of awards, and appropriately so, perhaps. But what's today different? So how do I continue on and get them comfortable with that? So,
Well, the badge of acceptance, we talked about it when we were, earlier, of a lot of people look for that social media, like,
right.
hey, look at my mom and dad just posted how proud they are of me because I've got this award that my company just acknowledged for me.
And instant gratification, right?
Yeah.
I can immediately send out to the world what I just accomplished or just achieved, and I get
Correct.
immediate feedback.
Yeah.
This like or dislike thing, right?
Yeah.
I can't tell you at work if I've never gotten a like and I've never gotten a dislike. I don't know what something. Right?
Yeah.
I don't. What is that about? But today, it's a thing.
Yeah.
And so how do we get there, and how do we work through that? But we have to be, as leaders, especially senior leaders, we have to be really sensitive to who we're working with, because there's going to be a point in time when I need to look up and understand from the stretcher that I'm laying on that
Yep.
the person in charge knows what they're doing.
Yeah.
So it's more than just a systemic thing. It's more than just a professional thing. This is a personal journey. It's a personal mission that I want to create that generation of leaders that when I'm laying horizontal, right? Every day I walk in, that's a great day. The day I roll in is not.
Yeah.
When I'm laying on that stretcher, I want to be able to look up and go, I trust that nurse.
Yeah.
I trust that manager. I trust that director. I trust that chief nurse. I trust that they've done their job, and I've helped them learn how to do it so that I'm going to come out of here fine.
Yeah. And thinking of going back a little bit to the barrier too, you mentioned, because you even started at the show, the second best thing is nursing, and the number one was being a father and a husband.
Yep.
And I think a lot of people are that way, myself included. A lot of people that I know that work with me and for me as well have that same mentality. New Mexico has some unique things for that kind of help you out there. Like, do you want to share a little bit more about some of the things I know you all are working on to help at least? Because I think that's really where a lot of the younger generation is, they maybe didn't see mom and dad because they were, at the office all the time or, and they did not want to be in that, like, I don't want to be my son and my daughter not to know who I am. But what are some of the unique things I know you've been working on at San Juan specifically?
Man, I'm telling you, New Mexico has one thing nobody else in the nation has
Yeah.
that is a pure win: free childcare.
Yeah.
You
Crazy.
come to New Mexico, your childcare is free.
Yeah.
Which means that income, mom and dad, one of them was working to drop into paying for the kids, doesn't necessarily happen. Now you work and you get that money.
Yeah.
Because childcare is free. And so this is unique to New Mexico. It is, in my mind, one of the most progressive things I've ever seen. And it is absolutely a win. And,
Yeah.
and so we are starting to see people come to us and be treated in a great way with that. So that's part of one of the San Juan things we're putting out there. But also the reimbursement today around healthcare professionals that the New Mexico state government just signed, $300,000 for physicians.
Yeah.
That's your medical school.
Yeah.
It'll get paid for, you stay. And there's similar activity on the nursing side. And so for us, that's the other things that we're really doing is we're looking at how do we pay back your student loans? We can do that. How do we on the front end give you money to go to school so that if childcare is paid for and we're helping you with tuition, look,
Yeah.
this is a good thing. Then
You're
of
living
course,
a whole new life. when
you
have
are
that
living a
revenue.
whole new life, man, and it is not a bad thing.
Yeah.
And then we're putting in programs today that look at not only how do we do that, but when you're a nursing student, how do we create a moment where you get health insurance
Yeah.
through us and a 401k? So how do we work that out? So we're going through the legal hurdles. We did that in Alaska. It was really successful. I would hire you as a full-time nursing assistant. You went to school 28 hours a week. You worked for me 12, and I paid you 40. So you were in school getting paid, and we were contributing to your 401k the whole 9 yards, and you worked for me for 2 years.
Mm-hmm.
By the end of that, you're 1 year away from being vested, and here's this whole pot of money that you're now going to get.
Yeah.
And so we're looking at the same thing in New Mexico to say, how do we make that happen? So there's all sorts of strategies around being creative and thinking about the student as an individual person to say, hey, I gotta take away every barrier they feel.
Yeah.
Well, if childcare is a barrier, insurance is a barrier, a reasonable wage is a
Student
barrier,
loans.
we're moving past all that. And so we're trying to make it as easy as possible for you to get into this profession. And it's a profession, and I've 45 years? I am still waiting on the day when I leave that I didn't enjoy it.
Yeah.
And I've yet to show up in the parking lot when I couldn't wait to get inside the building.
That's probably one of the most important things about a leader. You got to go in and love what you do every single day.
Every day. And,
Yeah.
and if you don't, then you really need to look in the mirror and
Yeah.
say, why am I here?
Yeah. What am I doing?
Yeah. And so I feel very fortunate that I'm in a place right now that really values nursing, and we value the opportunity to be successful, and we see a future that's really bright.
Yeah. So thinking of that, that's your retention. That's why you come in every day, and that's because
Yep.
it's meaningful. It's your it's your passion. It's your calling. Not everybody operates that way, which is okay. What do you see as different areas to help retain those up and coming leaders? What are some of the things you seek to do or think you've been able to do in your past? It didn't have to be here today, but what are some of the things you do to retain those up and coming leaders?
So we really do think about some of the strategic things that make their life
Mhm.
easier. One of the things that they asked me for, and I will tell you that I haven't done it yet because I got the request on Friday, but I thought it was brilliant. Give me a phone that's not my personal phone.
Yeah. Crazy.
Right. Well, it's like, where did this come from? And so one of my managers says, Alan, my mom's got my phone number. My husband's got it. The daycare has it. The school has it. All the nurses have it. And so I'm not off
Yeah.
because I also have on that phone my email, and the house supervisors know so if you'll give me a phone that's mine, and I don't give my personal number out, but I give my work number out at work, now when I'm not the manager on call, I can turn it off.
Yeah.
And so they're asking for clear delineation. They're asking for things like, and this is one we will do, they're asking for more support at night because their span of control, like we talked about, is so large with people, but it's so large with obligations, but 24/7. And so that means that if there's a problem at 2:00 in the morning, they're getting called.
Yeah.
So if we provide management at night for them, that's not the house supervisor, because they've got the entire platform to think about, then that gives them yet more good sleep at night. And now they don't have to be there,
Mm-hmm.
and they don't have to get that phone call at 3 a.m. And that allows them to get through and be rested. And of course, there's all sorts of science around how sleep works. So we're thinking about how do you then give, better span of control by stopping some of this, and then all the other things we talked about with, coaching and mentoring and all those sorts of things. But then the most recent evolution of thought, and we were there in Alaska, but we haven't thought about it yet at San Juan, is when do you give me a break and give me the opportunity to take a sabbatical? So at year 7 in Alaska, we were working on this with our physicians. It was at year 3
Okay.
where we were giving them, 3 weeks off at year 3, and you could go to year 5 and you got 5 weeks off, and we didn't go beyond that. But we're thinking through that process right now for managers in particular and directors to say, all right, you've been here 5 years. Why don't we give you a month?
Yeah.
That's not your PTO. That allows you to go and learn a new skill, volunteer someplace you want to volunteer, or do something that is in some way related to your career, but doesn't require you to make out schedules, do payroll,
Right.
and attend meetings with the chief nurse.
Yeah, that's impactful.
And
Very
so
impactful.
we need to figure out how that's going to look and how that's going to work. And we need to figure out what's the right time. The finances on it, in my opinion, are a no-brainer. If I give you 4 weeks off, and so it's going to cost me your salary for 2 weeks and or 4 weeks, and you're not going to be there to answer my phone calls,
Yeah.
but you're going to come back refreshed, and you're going to think,
Yeah.
hey man, 5 more years, I get another month off. And if I want to go be a nurse in Australia, or I want to go to Argentina because I want to go work in a clinic in Argentina for a month,
Yeah.
so it's extraordinary. So it's been happening in academic environments for a long time to keep people fresh. But I think really nursing has to think about these sorts of things long term, because there's so many opportunities for these young, smart people to go elsewhere to be CRNAs and nurse practitioners and whatever else, that midwives, whatever else it is they want to do, or go work on the private side, right? Which is such a draw. You want good, highly qualified, talented nurses.
Yeah.
So how do we do that to keep them around? And that's so we're thinking as far out of the box as we can. And we've taken the stance that while money's an issue ultimately, to start with, as we brainstorm, don't consider that. Let's consider instead the investment we would need to make to be successful, and not the money we would need to spend.
Yeah. Well, and you think about, you even think about some of the young leaders now. You gave me some horror stories back to my day, because I was in my own personal life, I've had to hold call. And when you have to hold call overnight, you never sleep. Like you never know if it's going to ring. You can't not pick it up. And so that is, if you can find a way, we talk about bringing on someone other than the house super, someone who can at least help support that when you're on the overnight call, that just makes life so much easier. I didn't have kids at the time, but anyone who has children and stuff, that's probably very difficult, because it's like, oh, gotta go to the hospital because I have to take care of this.
Right.
Some of the other things that I think about though are, you have young leaders who just had, like, they might have been 2 years in their profession and then COVID hit, right?
Right.
And you're like, I don't want to do this. Like, what are some of the things when you think about those horror stories, the potential, horror stories, quote unquote, that people have in their mind? Like, what might you kind of tell them? Like, hey, don't look at those things necessarily as the constant and everyday. Like, how would you coach them on supporting them in their future, to make sure they understand that there's light at the end of the tunnel?
Yeah, one of the things that we really stay away from in my world is the use of the word crisis.
Okay.
I'm not a fan of the word
Yeah.
crisis, because
can see it.
usually when you tell me you're having a crisis, well, it's usually we didn't plan well, or we didn't think about consequences, or we didn't optimize what we've got available to us, and so we ended up in a state that we shouldn't be in.
Yeah.
It wasn't a crisis though; it was something we created, right? Because we just weren't good enough. So we think a lot today about going forward and going ahead. And when people go through those rough spots, so COVID was terrible. We talk about what was terrible about COVID, and then what can we solve, and we break it down into bite-sized pieces.
Okay.
There is no problem that cannot be solved if you can get it down to small enough bites.
Yeah.
And
True.
so during COVID, what was the emotional thing that we went through? Well, we had a lot of death.
Yeah.
Right? That was
That's
real.
the hard thing.
But it was really made hard by the fact that we were not letting families in to the hospital.
Also very hard. Yeah.
So when I was in Michigan, we solved this during COVID by we were the first hospital in the country to do it. We figured out how to have families visit at the bedside, and we did it early on when nobody else was doing it.
Yeah.
And we had resources and we put it available, but it changed so much about how our nurses perceived everything.
Yeah. Well, and I think one of the things that nurses are generally caregivers at heart. There's a reason why they are doing that. And when you see the things you saw during COVID, which is unnatural,
Yeah.
it can take a toll, especially on people who have genuinely good hearts. Like they really want to do the right thing, and that can be very difficult. So probably lost some of those, that caused some loss in that upcoming leadership pipeline potentially. But obviously those who did make it through are that much stronger and should be able to manage and handle pretty effectively.
100%. I think if you you go through any of those situations, you come out the other side with a set of skills you didn't have before.
Yeah.
And one of the advantages we have having gone through COVID is that now we know,
Yeah.
right? Now we know. We know what worked, what didn't work. We know
Yep.
the strategies to keep our staff engaged. We know the strategies to keep our leadership teams engaged. And again, it goes back to the same things that are happening today about, do you get the support you need? Is somebody authentically caring about you? I
Right.
tell everybody so I meet all the nurses. Meet all the nurses when they start. And the first thing I had this conversation with is, do you know what a chief nurse does? And nobody in the room knows what a chief nurse does.
Yeah.
So then I have to break it down. It's, well, you got a manager as the boss, right? And you got a director who they report to, and you got a vice president. So I tell them, I'm your great grand boss.
Yeah.
Okay. And so I want you to have that in mind for just a minute, because what my job now is to make sure that you're safe. I want you safe emotionally. I want you safe physically.
Yep.
I want you to have the materials you need to provide at work without struggle or strain or stress. That's my job. And then there's all the strategy and finance and all the other sorts of things I do. But really, for you as a nurse, my job is to take care of you. And as a great grandboss, because you want to make that connection to your grandparents, right?
Yeah.
Who did you like the most, right?
Yeah.
It was fun being mom and dad, but
Yeah.
better going to grandma's house.
Yeah.
Right. And so we want that connection of real authentic care. And with COVID, those were the things that worked.
Correct.
It didn't work sitting in your office. It only worked when you went out onto the units and you met the people and the staff and you engaged in the same things they were engaging in. And so now we know.
Yeah.
Now we've learned a lot. And so I would say to young leaders today, those things were hard, but we survived and we grew and we got better. And look at how much more successful we are today in teaching and growing and retaining. If we had not had the COVID experience, I don't know that we would have got it.
Yeah.
So and that's, I think the other side of this is, you can always look and find what's wrong. It's better to find what's right.
Right.
And figure out how you can grow from it and get better.
Yeah. No, that's great. I think that's great words for all those up and comers. When you think about what it is they're facing and trying to get to, I want to pivot to one more topic before we close out, which is AI and data. So I know many people could spend hours talking about AI and data, but in a nutshell, how would you, kind of believe, or what do you see AI and or the data component of the industry, how it will impact your future leaders?
For sure in nursing, it's going to change a number of things, many of them for the positive, right? So I think the thing we see is the early alerts that your patient's deteriorating. That's a wonderful thing. The medication, barcode administration things, and how that's going to evolve into the pharmacy world, where we will hear immediately that we have drugs that don't work well together, or we've not incorporated something and it'll make us safer. I think those kind of things are going to be important. I think it'll change the scope of nursing. But I do think on the AI side in particular, we have to let nurse managers, nurse leaders know that AI really doesn't mean that your CFO can take hours away from you.
Right.
You still have to take care of the patient. I don't care how good the AI is.
Yeah.
I've still got to take care of the patient. So I'm not giving up my hours. But the other things around data, it's going to give us so much. So you have to figure out how to really leverage AI to enhance your abilities with data. So how do you go from, as you've seen the pyramid, right? It's data to information to knowledge to wisdom. And so how do we get there quicker? And AI can help us get there quicker, but we still have to teach the nurses how to use the data. So how do you tie, for instance, your staffing to a financial metric around quality? Or how do you tie quality to finance? And how do you tie your happies and your cauties and all these other things that we achieve? What does that look like? What are the early indicators that you're about to have one? And how does AI help us get there?
Yeah.
Right. So it can identify issues earlier for us. And so that doesn't take away from our need to be critical thinkers. And we have to continue to be critical thinkers. One of the most interesting, vexing things we've run into is the concerns and complaints that I get from our nurse managers and directors about resumes. Every resume is an AI resume.
Yeah.
Right. And so
paper looks good now.
Everybody looks good. Like, I'm like, I'd hire that person tomorrow, right? They can walk in the door. And then when you get them in front of you and you're doing the interview, you're going, that doesn't match the resume.
Yeah.
I'm not getting anything out of this. And so what we're having, AI has really driven this notion for us that we have to change our interviewing skills. And so we've talked about who gets trained to interview and analyze interview questions. And when you ask that question in a room, no hands go up.
Yeah.
And so we're focused now on our leadership team. In fact, tomorrow I'll teach this when we get back to Farmington. We're going to talk about interviews. Here are the interview questions. And what's the answer mean? Because I can answer the question, I can ask the question, you give me the answer, but what's it mean?
Right.
And so AI is doing a lot of things for us, but it doesn't mean we don't get to critically think. It doesn't mean our jobs aren't going to go away. Remember, we're in a very high touch business.
Yeah.
Right. One of the first, by the way, this is a new thing that we have seen with young nurses in particular. We have to tell them now, I want you to go into the room and physically touch the patient. When you do report, I want you to go in and put your hand on the patient, not with a glove.
Yeah.
If it's appropriate and they're not in isolation, I want you to hold the patient's hand. I want you to put the hand on their shoulder. And that physical touch thing, it has changed.
It'll change the way you no longer view that person as a person now.
100%.
Not that you don't normally, but it changes a lot. I can tell that would make a difference.
And they view you differently.
Yeah.
And so, I go make rounds and I frequently will sit next to the bed and hold a hand. But if it's appropriate, I'll say to the patient, do you mind if I sit next to you on the bed? And you can see facial expressions change overnight, like almost instantly. It's like, boom.
And
the
care
nurses,
about me.
Yeah. And the nurses come into the room with me because I don't do those conversations alone. Those nurses come into the room like, oh my gosh, he just sat down on the bed and he held the patient's hand.
Yeah.
It's incredibly powerful. So that's one of the things we have to do. And so we've got a lot. Artificial intelligence never is going to take away that, right? It's a high tech business, but it's a high touch business. And I got to connect with you and it's got to be authentic. Nobody cares what you know until they know that you care.
Yeah.
And my first obligation with that patient is to let them know that I care. And I also have to let the nurses know that I care.
Yeah.
I mean, all these themes come back together, but that's really where it is.
Yeah. I'll tell you, I'm not ready to look up when I'm horizontal to see a robot or something
Oh
up
my
there.
goodness.
So while I embrace the AI vision, hopefully it's limited to the automation of efficiency.
Yeah. Bring me the meds on a cart down the hallway. Yeah. That's exactly right.
Well, as we look at wrapping up today, I want to just close out with one question. What advice would you give to those leaders that are up and coming today, knowing what you know today?
Don't be afraid to fail. You're going to fail. You're going to make mistakes. That will not define you as a person. It will not define your career so long as you learn.
Yeah.
And so many
Good
times
advice.
We are afraid to take that chance or that risk. We're afraid to be extraordinary because we're afraid to fail. And if we fail, we're afraid of what people will say about us.
Yeah.
Lots of examples throughout history of failure that turned into something extraordinary ultimately. And so that's what I really would love everybody to understand is these roles are great. You get to impact so many people over the course of your lifetime, people you don't even know. And it's so gratifying to do it. But if you're afraid of making a mistake, you're never going to be successful.
Yeah. I like to think of it the same way that if you don't know how to fail, you don't know how to succeed.
That's correct.
And I truly believe that is great parting words. Alan, well, I want to thank you so much for being with us today. Today's discussion was highlighted that developing nursing leaders is about much more than filling future leadership roles. It's about creating the leadership capacity organizations need to drive performance, support their workforce, and deliver exceptional patient care in an increasingly complex environment. Thank you again for joining us today on Elevate Care. I'm Steven Endsley. Thanks for listening.
Thank you for joining us today on Elevate Care. If you found this episode valuable, please consider sharing it with a colleague and subscribing to our show on your favorite podcast platform. You can learn more about this episode and our show on our website at amnhealthcare.com and follow us on social media to stay updated on new episodes and the ever-changing world of healthcare.